Hi, here's Dr. R. Today we're going to talk about this masterpiece of an article talking about periodontitis and cardiovascular disease. It's a consensus report. That means that the European Federation of Periodontology and the American Academy of Periodontology did a workshop where they worked together to review all the literature available relating gum disease and heart disease. And they come into some conclusions. Since this is a great piece of article, we're probably going to have to break it out into 2 or 3, but let's start. So, the way that this article works is they bring up some questions and they actually use the most current literature to back up the answers. Let's start with the first one. Is there evidence of bacteremia on patients that have gum disease being on normal function or any dental intervention? And the answer is yes. They mention a couple of articles that actually reported that even by brushing, by flossing, or even by chewing on patients that have gum disease, they will have an increase of bacteria in their circulation that will go throughout their body. Most significantly on patients that have more severe form of the disease and have a more acute form of the disease. Another great question was, is there evidence of oral bacteria in the atheroma lesion? Atheroma lesion, by that we mean the formation of plaque that forms within the vessel, especially in the heart, that can cause heart problems. There was actually some very interesting mentions on that. They found actually some RNA, DNA, and antigens from oral bacteria on those lesions. They actually mentioned a study that was very interesting that they collected part of the atheroma lesions, they cultivated, and they were able to see the development of some of the very common bacteria present on gum disease. Another great question that they had some answers to is the oral bacteria can cause the formation of some of the atherosclerosis lesions? And yes, they mentioned a couple of animal studies that show that the bacteria can influence the formation of those lesions. They also mentioned some human studies on some special type of bacteria that are very common on gum disease, like P. gengivalis again. They were actually invading the endothelial cells and will help on the formation of the atherosclerosis plaque. Another great question relates to, do we have evidence that cytokines from gum disease that correlate with heart disease can influence each other? And yes, there's evidence that shows the most common one is C-reactive protein. There are studies that show the C-reactive protein is elevated on patients that have gum disease and patients that have heart disease. But when they have both, the C-reactive protein is even more elevated. And most importantly, when they have the treatment for gum disease, the C-reactive protein is significantly reduced, which is a great thing. Another thing that they mentioned is the interaction between neutrophils and the cytokines they are released. Neutrophils are the cells of first line of defense against aggression from gum disease. The neutrophils will release those cytokines. Your body is going to become more sensitive against those cytokines, therefore an increased inflammation. They're exposed to those cytokines. Studies that actually show that even after the periodontal treatment, those patients are still going to be hypersensitive to those cytokines, which is very interesting. So on that note, you don't want to be exposed to those cytokines in the first place because that's going to make you more hypersensitive to them. Therefore, they will cause increased inflammation for any other aggression you might have. Another great question that the article brings is, do we have evidence that patients with gum disease has an increase on thrombotic factors that will make them susceptible to complications from heart disease? And the answer is yes. There are some articles that show that patients that have heart disease and gum disease have an increase on fibrinogen. Fibrinogen is one of the proteins that will participate on the coagulation cascade. Therefore, those patients will be more susceptible to complications from blood clots. This could be one of the major problems for heart disease. When we put this all together, there's multiple ways that gum disease can influence heart disease. And there's many references to that. So, in a nutshell, as we have mentioned before, prevent gum disease by having a proper home care, by having a proper professional care, and by being checked once a year. If you have the problem existing already, you gotta take care of those issues and then follow up with the maintenance we have just mentioned. This is a very simple way of getting your mouth back to health, and it will only help to make your body healthier.